As the fight for control in Sudan stretches into its third week, the East African nation's healthcare system is collapsing. Deadly fighting has forced most hospitals in the capital city of Khartoum to close. Hundreds of doctors have fled, and the New York Times reports of rumors that some doctors are being kidnapped at gunpoint and forced to treat members of the Rapid Support Forces. So joining us now is the Executive Director of Doctors Without Borders, Avril Benoit. Thank you so much for joining us. I can't imagine, I don't know, but I can't imagine that the healthcare system was, A+ before this started in Sudan. How dire is the situation now on the ground?
Well, it's absolutely catastrophic, I would say, at this point, when you've got so many hospitals that have come under direct attack. We have medical facilities that have been completely looted. Even you spoke of Khartoum, but also in Darfur, there have been a number of really violent incidents involving health facilities. It makes it so difficult to be able to provide that life-saving care. And of course, you have war wounded that need immediate attention, but you also have all the other people that are coming in after having an accident, giving birth in an obstetrical emergency, any number of things that can happen to children. People need to be able to access a functioning hospital or clinic. And under the circumstances of so much active fighting, they just cannot do so. Everyone's afraid.
The World Health Organization says there are about 24,000 women due to give birth in Sudan in the coming weeks. What's being done to help them and specifically their babies?
It's incredibly challenging because you do have some doctors and health workers who are doing their level best to continue working. And there is a Sudanese network of dedicated volunteers that are showing incredible courage. But even for us, knowing that there is so much risk even going from A to B, for us to even be able to reach those facilities, to replenish their medical stocks is a risky operation, and it must be done very carefully. Yes, there are neonatal cases. There are women in obstetrical emergencies. There are burn victims. There are all the things that would happen quite outside of the injuries sustained in war. And those people are going to facilities where maybe the doctors and nurses have fled for their lives, where there have been attacks, where there are no more supplies like anesthesia to perform surgery. So you can imagine that for us, it's devastating because we know that we have an expertise of working in conflict zones, but under the circumstances, sometimes it's just not possible to move.
I can't imagine there's a working government because this conflict is about forming a government. So is there even a health ministry?
Well, that I would assume is still the case, but it doesn't mean that a health ministry or that health authorities are able to function because they probably have fled themselves. Mm-hmm. And this is something that we see time and again in conflict zones, is that people should be able to flee, and it's not always possible. So you take those little moments of ceasefires and so forth, but somebody who's an official can do a lot remotely. But what you can't do is move and provide the medical personnel where they are needed in the hospitals that have so many injured people coming in. And so there are some parts of the country where it is possible to work. And we continue to have medical teams in numerous states all over Sudan. So what has happened is that people have moved from the hot zones, such as spots in Khartoum, most of Khartoum, outside of the city, working in other areas in order to be able to support from a distance.
Well, we wish you, I know it's difficult, but the work that you do, I've seen it with my own eyes. The work that Doctors Without Borders does in conflict zones around the world is absolutely essential. And if not for you and those who support you on the ground, the local doctors and healthcare practitioners, this would be, it's already pretty bad, but I cannot imagine it without Doctors Without Borders. So thank you for all that you're doing, Avril Benoit. We appreciate you.
Thank you.